Morning everyone, right to go. There are 19,970 confirmed aggregate cases of coronavirus since the beginning of the pandemic. That is an increase of just 28 new cases since my update yesterday. That is the first time that the case numbers have been in the 20s since the 24th of June. That is a fantastic outcome and a tribute to the hard work and the sacrifice, the contribution that every single Victorian is making. And I want to say thank you, and I want to say how proud I am and all of us are of the job that's being done in households, in communities, in suburbs, right across Melbourne, and indeed in regional Victoria as well. This strategy is working, these numbers are falling, and that's exactly what we have to do. We have to stay the course and get this job done, get these numbers low, because that's when we'll be able to keep them low. If we open up when they're too high, then they will just get higher and higher. That is not only inconvenient, much more than that. It's deeply frustrating, but that's the reality we face, and none of us can deny the reality of those circumstances. But these numbers, the trend is with us, and these are very pleasing numbers today. Obviously, numbers that are not pleasing, they're a terrible tragedy. I have to update that there are now 745 Victorians who have died as a result of this global pandemic. That is 8 more since our last report. 1 female in their 60s, 2 males in their 80s, 2 males and 3 females in their 90s. Six of those 8 deaths are linked to aged care outbreaks, and of course we send our condolences and best wishes to those 8 families. There are just now 97 Victorians in hospital, 12 are in intensive care, and 6 of those 12 are on a ventilator. A total of 2,535,134 test results have been received since the beginning of the year. That's an increase of 14,247 since yesterday. Again, I thank each of those more than 14,000 people who, in the 24 hours before then, went and got tested. Thank you so much for that. It's a really important contribution, but the message again to every single Victorian, regardless of your postcode, your background, your circumstances, doesn't matter. This virus does not discriminate. Everybody's got to play their part. If you've got symptoms, even the mildest of symptoms, please come forward and get tested. Arguably, there's nothing more important than doing that. It gives us the most complete picture. That means we can support you, and we can make sure that you're not giving it to anybody else. That's the most important thing that we can do. We'll have more to say about some innovative approaches, some community testing. Alan, I think, if people give him an opportunity, he will probably speak about the southeast and some pop-up testing, some testing activity that's going on there. But anyone, as soon as you get even the mildest of symptoms, come forward, get tested. You'll get your results within 24 hours, and then you're playing your part in a really powerful way in our collective fight against this virus. There are 4,272 cases with unknown source. That's a decrease of 6 since yesterday's report. 143 healthcare workers who are active cases. We wish them well. We thank them and their colleagues for the amazing work they do across the state every day. The rolling average 3 September to 16 September, Metro 44.4 cases, regional 2.9 cases. That I can also add to that by saying that there are 33 active cases in regional Victoria, so those local government areas that comprise regional Victoria that are now moving into step 3 as of midnight last night. There are only 2 cases that are active in disability facility settings. They are both staff members. So with a really determined and dedicated focus, we have contained some challenges we had there before they became at crisis level. We've been able to drive those numbers down. This is very pleasing given the underlying vulnerability of many people who live in those settings. Aged care shifts, so all the public, all the nurses, all the hospital staff that have gone into aged care, private aged care, some 4,507 shifts, a massive effort, and I thank, on behalf of all Victorians, and particularly on behalf of those who are in residential aged care, I thank those hospital staff for the amazing work that they have done. In terms of aged care outbreaks and active cases, there are 464 active cases in aged care. It's my understanding that they are all in private aged care, and there are a number of outbreaks. The latest outbreak number, I believe, is 75 that are active outbreaks. That is pretty much all the numbers that I needed to take you through. I'm now going to ask the Deputy Premier and Education Minister to speak to a a very important and targeted package around early years, so kinder, and also some additional support for vulnerable students. And of course, I should just make the point, the feedback from across regional Victoria in terms of the return to school arrangements, what will essentially be as close to a normal term 4 as possible. It's been very, very clear that parents are particularly excited about that. Just as people across regional Victoria, they've got that hope and optimism, having seen a strategy work to get the numbers down and now to be able to take these safe and steady steps. But I'll just say this to regional Victorians. The rules have changed, but there are still rules. And it's really important that regional Victorians remain vigilant. Just as we are remaining vigilant, the announcements that Victoria Police made yesterday in terms of an almost $5,000 on-the-spot fine, additional cars being pulled over and checked. There's no reason. It is unlawful unless you have a very clear reason to be in regional Victoria. Those reasons are up on the website, they're well known, but we just can't have people taking this virus with them as they unnecessarily and unlawfully travel to regional Victoria. But that's one set of obligations. At the same time, every regional Victorian is obligated, having given so much, having done so much to create this sense of absolute optimism and the opening up, they too need to make sure that they remain vigilant, following different rules, but rules nonetheless. This is a really important step we've taken this week in regional Victoria, and it's a very clear demonstration to everybody in Melbourne, who I know is doing it tough, but it's a clear sign, not as a matter of modelling or a matter of theory, but in real practical terms. You can get these numbers low. You have to get them low to keep them low, and once they're at that low level, you can open up. I'll now ask the Deputy Premier to take you through some of these very important education announcements.
Terrific. Thank you, Premier. This has been such a challenging year for our schools, for our early childhood providers, and today we are announcing a significant package focused on early childhood education. It's a $26.7 million support package, kinder support package for term 4. And in doing so, can I thank our early childhood educators, our early childhood teachers. They have gone above and beyond right throughout the course of this year, whether it's on site supporting children and their families or working remotely and supporting those children and families. They have been outstanding. So I just wanted to take this opportunity to express my thanks and gratitude to our early childhood teachers and educators. So this package does a number of things. It helps parents with the cost of fees. It ensures our kinder providers remain viable. And importantly, as we think about term 4 and the 4-year-old kinder kids, it supports the transition to primary school in 2021. So to break those numbers down a bit, $13 million of this fund goes to free sessional kindergarten. So this supports parents with the cost of fees, providing the payments around $500 per child. So free sessional kindergarten. This is local government, community-based, school-provided kindergarten. Free sessional kindergarten for term 4 across the whole of the state. So this is a really important announcement and builds on what we've already provided to parents through term 2 and term 3. In terms of the vulnerable children, the highly vulnerable children that the Premier identified, there's an additional $3 million, and we're going to be providing an additional 5 hours of kindergarten for these highly vulnerable kids. So we're talking about 5 to 7% of children that go to 4-year-old kinder. We'll target those services that have got a high proportion of disadvantaged children. It'll be an opt-in, but we will be providing that additional 5 hours of support. In terms of transition, $4 million to support transition from kindergarten to primary school. In a normal year, you would have your 4-year-old kids visiting their local schools and engaging in those schools, having a look around, getting comfortable with the school setting. This is not a normal year, so we're gonna flip it, and this funding will provide support for teachers to visit the kindergarten providers. All kindergarten providers will be able to access this. So teachers will visit the kinders, engage with the children, engage with their families, and make sure that the kids are ready for a successful transition from 4-year-old to primary school. We will have a particular focus on re-engaging Aboriginal children, children from a called background, and also children with additional needs with a disability. So we'll have a particular focus on making sure that we engage those kids. So this is a significant package of support. It will continue the cleaning and hygiene grants, so those grants that have been available for early childhood services through this term will be available through term 4 as well, and I know that will be well received. So this is a significant package of support for early childhood educators. This is not a normal year, but what we are doing through this package and the wonderful work of our early childhood teachers and educators and our teachers, the prep teachers at schools, we're going to make sure that this is a successful transition year for those kids and their families.
Very good. We're happy to take questions.
Can I just clarify, is that 3-year-old and 4-year-old kinder will be free, or just 4-year-old? Sorry. You're welcome.
So it's free for 4-year-old kinder, and where we have funded 3-year-olds, so we're transitioning to universal provision. So where we've got funded 3-year-old kinder, it will provide that fee relief. But there's also an allocation, it's around $3 million or so, to provide support for unfunded 3-year-old kinder.
Has anything changed in terms of the back to school provisions for term 4 in regional Victoria? Is it still going to be staggered over 2 weeks, or just the first week?
Okay, so what we were able to do, the terrific result we've seen in terms of the numbers in regional Victoria, the advice from our public health experts is that we're able to bring the transition from the 12th of October to the 5th of October. So what that means is from Monday the 5th of October, day 1 of term 4, primary schools, so P to 6 schools, schools will be able to start on the first week of term. They'll make a local decision whether they have their preps on the Monday or whether they have their grade 6s on the Monday, but the transition will happen in that first week. For secondary schools, we'll continue with the settings that we had. That is, we keep our secondary schools free for assessments and the GAT on the Wednesday. And for P to 12 schools, there's a number of P to 12s in regional Victoria, we'll have the primary school children, so P to grade 6, starting on the Thursday of that first week of term. So yes, we were able to bring, because of the great results in regional Victoria, that meant we could make a corresponding change to the settings we had for schools in rural and regional.
Minister, is there any flexibility in Metro Melbourne, particularly grade 6 kids? There's a particular concern around grade 6 kids. It's such an important year.
Yeah, look, it's a milestone year for grade 6 students, their last year at primary. It's a milestone year for year 7 students, their first year at secondary school. But we're not making any changes, and we've got to go back to why. The settings we've had in...
So there's no flexibility on that?
No, the settings we've had in schools has always been around public health advice about the movement of people. So the public health advice is that we could transition back. We would never have been in a position, we would never have had public health advice to, on day 1, transition 1 million students back to school. It was always going to be staged. So that was the advice we've received. The priority cohorts are the little kids because they're the hardest in terms of a home learning environment, and obviously senior secondary and special needs. So I understand their significant years, grade 6 and year 7. I've got my own daughters in year 7, and I want her back. I want her back at school face-to-face teaching, but I also know...
It's your call though, isn't it?
Sorry?
But you get to make that call, don't you?
Well, the call is based on public health advice, and that health advice is that we've got to have a staged transition back to school. We were never going to be able to transition every single student at the same time. We want to get to face-to-face teaching as quickly as possible, but that will be based on the case numbers. First cohorts have been announced for Melbourne, and when I have that advice that we can transition other cohorts, that's exactly what we'll do.
As soon as you get that advice, you'll act.
Yeah, as always, as we've always done. As soon as we get public health advice, we transition kids back to face-to-face teaching.
Will there be students, just looking at Year 12, will there be some regional Year 12 students back in the classroom when the Metro Year 12s won't be? And does that change
No, we've always been really clear. The consistent thing we needed to achieve was for regional and metro VCE VCAL students doing exactly the same thing at the same time. That's why for the first week of school, from the 5th of October, senior secondary in both regional Victoria and Melbourne Metro are doing the same thing. They go into school only for assessments and the GAT, and then all seniors are back at school face-to-face from the 12th.
Is there any teachers who, say, live in metro area but work in the regions, will they have to get work permits and pass?
Yeah, as has been the case in the past, they'll continue to be able to work at the school that they work at, so they won't be working remotely if they're doing face-to-face teaching.
Let's ask Alan, unless anyone's got more.
I've got another question. Sorry, in terms of childcare, there is a big concern that they're not going to return to the levels that they were pre-pandemic. Is there discussions going on with the federal government about some continuation of funding packages to keep them running?
Yeah, there's discussions and advocacy. So the federal government announced a further couple of weeks of support, so that goes to the 27th of September. I've been engaging with the sector. Now, childcare is a federal government responsibility. I've been engaging with the sector. They're seeking additional supports, a continuation of support, and we're advocating to the federal government to do that. At the moment, the support has been extended to the 27th of September. We're advocating for continuation of that support and would welcome it.
Does it seem as though they are open to that, or is it, even though you're advocating, have they said no?
Look, that's something you'd have to put to the federal government. The sector is advocating strongly. We're supporting the sector in that advocacy, but ultimately this is a decision of the federal government.
James, are you seeing a lot of demand for school counselling during the remote learning period, and what's being done to meet that demand? Yeah,
there's been a real focus on student health and wellbeing, and as I've said many times, there have been kids that have thrived under remote learning and others that have suffered under remote learning, whether that's academic or mental health. So what we made sure is that every school has a dedicated wellbeing team, but we made it clear that parents understood who is the contact person at each school. And there's been real deep engagement supporting kids that are struggling. We announced some time ago now $28.5 million of additional mental health and wellbeing support. Engaging kids that are disengaging. Our attendance and absence rates actually have been pretty good, but there is a cohort of highly vulnerable children that are struggling, and that's why we've had this focus on health and wellbeing.
So can a child access counselling via Zoom, remotely? How does that work?
Yeah. There's counselling support that is remote, so you can have both engagement with school wellbeing staff, but also we've had other partnerships with Headspace and others to provide that online counselling to children.
Sorry, and has the department got numbers around, you said there was an increase in demand, can that be quantified?
I'll come back to you with any specific numbers that I can provide to you, Noel.
Could just ask Alan a bit about some of today's numbers. With 28, are they linked to places you already identified?
So 28 cases today, and I think 14 are linked to known clusters. The cluster, obviously, of concern at the moment is in Casey, and we're looking at that very closely. We've been working with Monash Health and the local councils, and with community leaders. Had a meeting last night with them, and in addition to all the clinics that are already in that area, there are 3 new pop-up clinics at Clyde Recreation Reserve, the Hallam Secondary College, and the Noble Park Rapid Response Testing Site in Noble Park. So really thank everyone who's come out to be tested, and encourage anyone, even with mild symptoms, to come out and be tested to make sure that we get on top of this.
How many of that 28 are linked to Casey?
So there were 5 cases in Casey yesterday.
And are you approaching this using the new suburban task force model that the Premier flagged?
Not yet, but I think it's a good model for it because we're essentially doing that. We're working with the local councils, Monash Health as the local hospital there, and talking to community leaders. And that's really what we will want once we develop these suburban centres. It's sort of important to have it on the ground. Yep. Sorry.
What were the testing figures like yesterday? Because we had a camera out there and it was virtually empty at one of the testing sites.
I don't know the testing numbers for that site specifically, but across Victoria it's been pretty good, 14,000 yesterday.
I'm just wondering you obviously targeted Casey and Hallam the last couple of days, and just wondering what the response has been.
Yeah,
like.
I'll have to get those numbers. I don't have them specifically.
And what else can you tell us about the cluster? Like how many links are you aware of between those cases, other than the fact that they're all in Casey? And are we talking workplaces? Are we talking family groups?
So we're still looking into that. We do think that there are links, and they're obviously all in that area. There's a number of households there, but I think it's we're looking into that and trying to make sure that we know where everyone has been, so that we can make sure that all the transmission chains are controlled.
Why is it taking so long to establish that? We had sort of 10 new cases in Casey about 5 days ago. Why is it taking so long?
I mean, we're talking to people all the time, and we go back and talk to them again and make sure that there's nothing we've missed. So, if you think of, where have you been in the last 14 days and who have you talked to, you don't, did you meet this person on that day or the day after? How long did you talk to them? All these things often can take a little while. And when, certainly I'm not doing contact tracing, but when I've spoken to patients, it isn't always easy to get the story out the first time. They have to go back into, their phone book and work out where they've been and who they've been talking to.
I understand that, but you've only got 30 in today, 28 cases a day to do, and you've got a team of 2,600 people to do it.
And so we are going back to them all the time to make sure that we know everything about where they've been.
Has the threat of fines been counterproductive? Are you finding people are reticent to admit that they might have been breaking the rules?
Look, I think it's always a balance, isn't it? That we want people to be truthful and honest and tell us where they've been, but we want people also to do the right thing. So I think there's always a bit of judgment in that, and I think that's something that they always take into account.
Alan, are you finding people are reticent to going and getting testing because they don't want to spoil the dropping numbers?
Oh, look, I would hope not. I think it's really, the most important thing is to get on top of the cases, and if someone doesn't come forward, then, they can cause another case, and then that spoils the numbers even more. So we would really encourage all Victorians to come out and get tested.
And of the 14 other cases, you had 14 linked to Casey and Hallam. Are the remainder mystery cases, or how?
That's 14 linked to known outbreaks, not just specifically Hallam. Yeah.
So the other cases, are they mystery cases?
Well, they're under investigation at this stage, so some of them will turn out to be mystery cases, but actually the number of mystery cases has been dropping, so we do eventually find out where most of these people, and sometimes that takes testing, so we look to see where they've been in the last 14 days, and then we have to do testing upstream of that to see where they've got it, and that might be might take a few days to arrange all of that to make sure that we've located the source of an outbreak.
Alan, what's the Metro active cases right now?
Actually, I've got active cases in general is 941, so minus 30 something, so it's probably about just over 900.
And how many of those are linked to aged care and healthcare workers?
I don't have those figures. This was a little bit early, so the report hadn't come in when I did
would it
that.
be a high proportion?
It is a high proportion of that, yeah.
How many of today's cases are linked to aged care?
Again, the aged care report hadn't come in by the time I came up here, so I don't have that figure, but we'll get back to you.
How much overlap is there between that aged care active figure and the health active figure? Because if I'm not wrong, that health figure includes aged care workers, doesn't it?
Yeah, so actually most of healthcare workers that have been infected are in aged care. So that includes people that work in aged care and not nurses and doctors in hospital. And I think the overall figure is something like 70% of healthcare worker infections have occurred in aged care.
Could you walk us through the PPE in aged care? We know that even though it's been virulent, if centres are being declared as being free of COVID now, we understand that the recommendation is that staff don't have to wear full PPE anymore, they just have to wear masks. It just seems that it's such a clear and present danger even still. Why wouldn't they be asked to wear full PPE?
So I'll probably have to refer that to Andrew Wilson as the Chief Medical Officer. I do understand that they are meant to be wearing PPE, but I'm not entirely sure of exactly the detail across exactly what they're meant to be wearing.
They're constantly being told they don't have to wear full PPE until there's an outbreak. But
Yeah,
in which case it would seem too late.
Yeah, no, I just make the point that a mask and eye protection is the most important part, and actually and particularly in hospitals, and again this is sort of separate to COVID, we often encourage people not to wear gloves. So obviously there are situations where it's very important, and we would for COVID patients, but when people wear gloves, often they don't do hand hygiene properly, and actually that's one of the most important parts. So in terms of caring for patients, it is the mask that is the most important, because it is a respiratory virus, and it's the most important thing is to make sure that people clean their hands, and we don't want anything to get in the way of that. So I'll have to get back to you on exact recommendations for aged care, but that's sort of the general way we approach it.
Can I ask the Premier something? Hi, Premier. Fin Review, we ran a Treasury economist today who was critical of plan, or had some feedback about it, was told to keep silent and to fall into line, and ended up resigning. I mean, are you happy to get frank and fearless advice from people who might have some feedback and call for some flexibility?
That may be his version of what occurred. I'm not briefed on the accuracy or otherwise of that. He's entitled to his views, but you, your readers, and all Victorians should be assured that we receive frank and fearless advice from the public service each and every day.
Can you explain? Sorry.
Well, just on the consultations, I was pleased to hear that you met with supermarket heads this week.
I did.
I think there's been 150 briefings there were with industry before the roadmap was released.
It'll be something like that, yeah.
Yeah. How many were you at?
Those matters have been appropriately delegated to the Treasurer and the Minister for Jobs and Industry Recovery.
Okay.
I've got one or two other things to get on with.
The point being that I guess if you were fighting a fire, you would get out there, you'd talk to people on the front line, you'd talk to healthcare workers, business owners. Do you think
well, that's a really
enough
interesting.
time to get out there?
I'm very pleased that you've taken me to that analogy. I didn't go to too many town hall meetings during the fires. I left that to those who are in charge of the operational response. Just like I haven't necessarily been spending all of my time. I lead a big team, a capable team, and they have engaged with industry in unprecedented terms.
Yep.
That's not to say, though, if I could be so bold as to point this difference out to the Fin and others, consultation and getting the answer you wanted are not always the same thing. You can be listened to, and people have been, but that doesn't guarantee that everybody gets exactly what they want, because many would like us to open up yesterday.
Sure, I get that. Some business owners have told me that they were told by ministers the zero case strategy had been decided before consultation began. Is that right?
No, that's not accurate in any way. There have been detailed consultations, and we will continue to have consultations. They have informed our decision making.
Yep.
For instance, if you look at regional Victoria, I think most restaurateurs, publicans, cafe owners didn't expect that there would be able to be 20 patrons inside in 2 groups of 10.
No.
That came from feedback as well as detailed public health advice.
Is there flexibility for that to happen in Metro Melbourne? Because they've looked at that and said, well, that's good. That is a real positive.
I think I went to this in some detail the other day. Essentially, we'll be guided by the numbers and the narrative behind those numbers, so the circumstances behind those numbers, and it's too early for us to be able to predict where we're going to be next week, let alone in multiple weeks' time.
Just on the September 28 date, the supermarket, the retail sector say, well, look, construction, manufacturing are going back with COVID-safe plans.
Yes.
They've said, look, if you're worried about movement, we could put in plans. We're willing to work with the government that staff could go to local stores. Is there any flexibility there about I think it's
much. Those settings are much less about staff movement. If you're talking about the broad settings, it's much less about staff movement and much more about customer movement. And again, there's a cumulative and aggregate impact. You can have an individual setting that is as COVID safe as any setting can be. That's not the issue. It's about letting all their customers out of their homes to go and frequent that place and do everything you do on the way there and on the way back. That's the real challenge of this. And that's why individual settings can be safe, or as safe as you can be. That's not the issue so much. It's not unimportant, but the broader thing about movement and people moving in, not hundreds of thousands, but indeed millions of people moving around, that is regardless of where they were going, and in some respects what they did while they were moving around, that movement's conducive with only really one thing, and that's spreading this virus rather than driving the numbers down.
Yeah, could you just explain the omnibus bill that's just been introduced into state parliament? What is that trying to achieve, and is that adding to the omnibus legislation that passed 6 months ago? Is it adding to that powers to detain people for their beliefs and what people say?
Well, it's dealing with some deficient, or I should say, it extends some arrangements. It deals with some other gaps that have become evident over the course of the last 6 or 7 months. In terms, I haven't got the bill in front of me, or a note that takes me to all of its different provisions, but Simon, I'm happy to arrange someone from the Attorney General's office or department to take you through all of those different measures.
Are you briefed on whether this bill would allow police more powers to detain people on their say, or conspiracy theorists, or
No, I think that there are adequate.
Out there
there are
virus messages.
So there are things, for instance, like giving to additional authorised officers powers, so we can have more of them doing more work. So not just police, trying to spread that enforcement role, which takes many different forms, everything from workplace inspections all the way through to some of the public order issues that we've faced.
Who are you thinking of?
Well, I'm more than happy to have someone come back to you and take you through each of the detailed provisions.
The Greens have raised concerns specifically about the clause on the preemptive powers of police. Considering that you relied on the Greens to get the state of emergency powers through, Samantha Ratnam came back from maternity leave in order to pass that bill. If you don't have their support, do you find concerned at all that you may not get this one through, or it may stumble in the upper house?
Well, let me just challenge the premise of your question. We didn't rely on anybody. We put a bill before the Parliament, and the Parliament voted for that, and the outcome is well known and well understood. In terms of these provisions, they'll go through the same process. They will go through the lower house, I would hope, then they will go to the upper house, and the upper house, particularly the crossbench, will make their own judgments.
The modelling you used to design this road, the modelling that was released,
yes,
had on September 17 the average cases for Melbourne would be 63. It's much lower than that.
Yes.
Are you going to do some new modelling and set some new timelines, given we're well ahead of this modelling?
Well, as I've said a number of times, Rich, actuals always beat assumptions. Data always trumps any model, even a robust model that's had input from many experts, multiple universities, 1,000 different inputs into that model. We update it regularly. I can't give you an exact date when we'll rerun it, because it's not just press a button. It does actually take 24 hours plus for all of those different permutations and combinations to be run through. But every Victorian can rest assured that as each day passes, not just in a quantitative and a qualitative sense. So the point I made yesterday a bit was, or tried to, there's the notion of numbers, very important. Then there's the notion of what narrative, what circumstances, what story sits behind each of those cases. And then the passage of time, which I know is frustrating, but the latency of this virus means that you do have to wait some time, because you won't know what the effect of your decisions has been for at least 10 to 14 days. So that's why some of these steps that's a considerable period between them, and that's kind of the fight that we're in. If you had a quick turnaround and you'd start to see the impacts in days, just a few days, then of course you could compress things down. But wickedly, that's part of the challenge we face.
Isn't that the whole point of having a 14-day rolling average, though? So you're not just relying on a couple of days' numbers, you are taking into account the last couple of weeks?
And again, if we finish up, as I've said a number of times, and you can flip around what I've said as well, if the tail of this thing is more stubborn than we hope, then of course we reserve the right to make a judgment at some point, well, this is as good as it's going to get, so therefore we have to adjust things for that. The opposite is true also. If we are confident that we've got an accurate picture via test numbers, that's why it's so important. Any symptoms, get tested. If we see test numbers get to a point where they're no longer a good proxy for how much virus is out there, then that makes those decisions really, really tough. But of course, if we finish up ahead of schedule, then we will we will adjust things, and we'll have more to say about that at the appropriate time. But you get, again, if only it was just one 14-day period. That's why it's rolling, so we add to it each day, and you've got to see patterns that are truly representative of what's happening out there. The moment we believe we have that, and the moment that was to say to us, for instance, well, we think we can go faster without risking it being a short-term thing, not something you can lock in, well, then of course we would update.
Are you concerned that after the lockdowns, workplaces closed, that you've still got, I think it's 83 cases since the lockdown of community transmission? Does that limit our ability to get out of lockdown, even if the averages come down and you've still got all these community transmissions? Does that limit the ability to meet those deadlines?
This has been a point of debate and discussion around the fact that we've not only talked about total positive cases, but we have to be mindful also of those mystery cases. They are a really important part of this. And I know that's very challenging, but the tolerances need to be quite low as well on total cases, and certainly those mystery cases. Logic just tells you for every mystery case, there's at least one other case out there where they got it from. That person's got close contacts. They in turn have close contacts. You can have a problem, you can have a pocket of this virus that's quite active and not necessarily know. I wouldn't say that we're any more or less concerned about those matters. They've always been a challenge. But that's why so much investigative work and hard work goes into trying to run those cases to ground, so that you know exactly, or as best you can, where that came from. So it's no longer a mystery. It becomes part of your certainty, and then informs the difficult judgments that we have to make.
Given half our numbers are still, given half the active cases are aged care and healthcare workers.
Yes.
Are you not looking at plans where you can open up the economy a bit more, society a bit more, given these cases are concentrated in known industries? They're known.
I think it's really important to acknowledge that whilst an outbreak may occur in aged care, and just one case sees us use the term outbreak, and that's a representation of just how vulnerable people in aged care are, it's more often than not the case. I'm more than happy to come back to you with some numbers perhaps to try and inform this, to the extent that we'd ever know. These are community transmissions coming into aged care. So the question here is, people who work in aged care live in families, they live in suburbs, they don't live in the facility that they work in, the workers I mean. And also, I think I made the point to Noel the other day, I think it's important to understand as well that there are very significant restrictions on private aged care at the moment, and public aged care for that matter. So the notion that it's kind of free and easy and it's open up, there's many would describe the settings in aged care as a lockdown. That's a term that I don't know whether I would use that, but there's a fair bit of really strict rules and an enormous amount of work going on to try and keep this out of aged care. That's happening now. The notion that can replace broad rules, we're not at that point yet. But I would just say to you...
Is it something you could look at when you get the numbers?
Oh no, we're already looking at all these matters. We look at every high-risk setting, whether it's an abattoir, whether it's a cool store, a hospital ward, an aged care. We look at all of those things, and we look at them each and every day. I would just make the point, which is kind of the next logical step from your question, Rich, that vigilance in aged care will have to be a feature of that COVID normal, and it absolutely will be. Because until a vaccine comes, there'll always be the underlying vulnerability that if it got into an aged care facility, then we all know what happens then.
Couldn't you just put, I guess, for example, stronger rules around aged care workers, trying to help them do their shopping, for example, so they're not at risk of spreading to the community?
We're constantly evaluating all of those matters.
With the track and trace system, is that fit for purpose now to be opening up? We hear anecdotal evidence of longish days for positive tests being tracked. Your regional hubs aren't up and running yet. Are we ready to go to a next step?
Well, no. You're free to put your questions in any context you like, but I think we can be a little more positive than that. Our regional public health teams are up and running and have done an amazing job in the Latrobe Valley, Colac. Some of the work that's going on in Casey is essentially a suburban public health team. So Monash Health is taking a lot of the lead there, working with all the partners. We will have those suburban local teams set up in good time. That's got to be done properly. That really does come into its own when you're down to very small numbers and you are open. That absolutely, even more rapid in the response. The issue here is that I'm not sure about what anecdotes you've heard. I know there's one case, apparently we're following it up. There's a GP has has raised a concern. We're following that up with the GP. The department is dealing with them directly, as they should. This is a notifiable disease, and I'm sure they'll get to the bottom of that. That related to one particular patient. All I can do is point you to the national dashboard, where we are well into the 90% interview within 24 hours, and we are just shy of 100%, so it's 99 point something, in relation to close contacts being contacted within 48 hours. We won't be satisfied with that. If we can make 99%, 100%, we absolutely will. And there's a whole range of different things we're doing, everything from new data platforms, some of that localised focus, so all the high-tech and low-tech to try and make sure that we've got the quickest and the most effective response possible.
When do you think the suburban hubs will be up and running and making?
I'm not sure. Let me come back to you. I don't think it's too far off.
What are you doing to speed up that time period between the test being taken and DHHS being notified? Because obviously, you know, as soon as someone has symptoms,
Sure.
there's a danger that they can be spreading it.
Absolutely. Well, that's why it's really important that people isolate and don't go to work, don't go anywhere after you have your test. If you've got the vast majority of tests are for people who've got symptoms, that mix may change a bit in the coming weeks and months when we move to do some more sentinel testing, some more double check kind of testing, if you like, in say aged care or meatworks or wherever it might be, just as we did with schools some months ago, where many thousands of teachers were tested. The time between the taking of the swab and the notification to the department of a positive, that has consistently come down. There's no delay between when the result is known by the laboratory and when the department knows. That's down to minutes, hours, less than 2 hours is the last brief I had on that. It's very, very short. So they're getting the information to us really fast. Give you one example, and if I can add to this, I'm happy to do it offline. We are doing multiple courier runs now from every single testing site. That's the advice I have, so that we're getting those swabs into the labs as fast as possible, because that means you get them out in terms of results as fast as possible. You would note as well that we moved to an almost exclusive focus on positive results some time ago. There's always a large number of negatives, and that's why, for instance, for a time we couldn't give you an exact testing number because we were just looking at the positives. Every effort's being made, great partnerships with the labs to get that as fast as we possibly can. And also, and I think Jerome might be in a position to be able to provide maybe some further information, if not just for you, Rachel, then maybe we can have him back in the next few days to talk about some of the work we're doing at the point of test to get the best information from people in the event that we have to contact them, and that drives down the number of people that we can't find, those 3, 4, 5% of people when we want to interview them, and we can't find them. So that's a bit of a snapshot. There'll be other things, and if we can get you some more information, we will.
All of that being the case, why is your modelling then based on 25% of people being interviewed in the 24 hours after their test is taken?
No, I think that Brett went to this the other day. There are some assumptions about what are called exposure days, and I'm happy. If I'm incorrect in that, well, I'm happy to have others go to that, and we can come back to you. But that it's not a reflection of contact tracing performance. It's a reflection of how long did the person wait. If I understand your question correctly, how long did the person wait or take, to be less judgmental about it? How long did people take between onset of symptoms and therefore their infectivity and the days before then, and getting the swab? That's what we try to factor in, and that's really challenging because, you know, we can appeal for people to get a test as soon as they get any symptoms, but what they were doing in the preceding days, that can be a really important factor in terms of how many people they've been exposed to, how much virus they might have spread. Again, that's why we have these rules in place, because if you didn't have rules in place, and even if you had very high testing rates, people would be going around to different settings. They would be perhaps unawares that they've got the virus, and they would be, with absolute certainty, they'd be giving it to many, many other people.
Can you clarify the reasons for crossing the Ring of Steel and say down at Little River is getting food a permissible reason?
If that's the only way you can get food. I think that what we've tried to do is draw a balance. If there's no other alternative for you to go to, if there's no other shop and you have to go there, I know that it's challenging for those border communities particularly. Can I say to you that I think we're less concerned, those rules will be enforced, but we're less concerned about a community like that, where their patterns of movement don't really take account of that border. We're much more concerned about people from, you know, the middle suburbs of Melbourne deciding that they're going to go to Daylesford for a day trip, that's just not on. We can't have that. And that's why the police made the announcements that they made yesterday.
And why was it left to the police to make that announcement?
Sorry?
Why was it left to the police to make that announcement? I know you'd alluded to it, but it was...
Yeah.
Why wasn't it you telling us about the new fine? Why was it left to...
Well, I'm happy to talk about the new fine, but those matters are, I think, rightly the work of Victoria Police, but I'm happy to say the new fine's nearly $5,000 and police are not mucking about. And if you're in regional Victoria and you're from Melbourne and you don't have a lawful excuse, you will be fined. And I think that is appropriate. Regional Victorians have given a lot. They've achieved an amazing result. We need to jealously guard the low virus status of regional Victoria. And one of the ways, not the only way, but one of the ways we do that is having, just not having people make unlawful and unnecessary trips into regional Victoria, because all that potentially does is spread this virus and put at risk the opening up and the different position that regional Victoria is in. The more this spreads, the further away as well, can I say, the Melbourne getting open up will be. So we've all got to be focused on those important things, driving these numbers down.
There's not much of a ring of steel if they disappear at the first sign of rain, though, is it?
Oh, well, again, I'll leave it to Victoria Police to talk about how these things work, but I'm very confident that there's a massive police effort going into this with support from others. These fines are very, very significant. And I think, to put it in broad terms, Laurel, anyone who thinks they might, take a punt on heading to regional Victoria and not getting caught, I think your odds are very poor. You should not go to regional Victoria unless you've got a lawful reason to do that. I don't think that's too much to ask either, frankly. Look, it's just a simple thing that will allow us to it'll help to keep the numbers in regional Victoria low.
There are some business owners who live in metropolitan areas.
Yes.
Who thought they'd be able to open up under the easing of restrictions in regional Victoria, only to find they can't. Is there anything that can be done to help?
Yeah, I
them,
think
or
that the
they-
public health team would look at those on a case-by-case basis. Again, I'm not wanting to prejudge that. That wouldn't be a decision that was made by me, but I'm sure that we're happy to try and work through those issues with people. For instance, I think Jenny was asked a few questions yesterday about surgeons, for instance, travelling from Melbourne to go and do surgical lists in regional Victoria. It's not exclusive, but it's a large feature of elective surgery in some specialty fields. We're going to try and bulk up those lists to do them in the short run, so do 2 or 3 days instead of coming back every week for 3 weeks, for instance. All of those sorts of things. So we're open to trying to cater as best we can, and there is a process to look at the individual circumstances. But I would just say, with the greatest of respect to those people, every exemption can potentially undermine the goal. Every exemption, because once you grant a whole bunch of them, then you finish up having to grant even more, and then you've got less people that are subject to the rules than those who've been exempted from them, and that doesn't really work.
So if you owned a non-essential business, say a beauty salon in regional Victoria, you think it would be unlikely you would be granted an exemption?
I wouldn't make a judgment. What I'd say is that process is one that looks at the merits of each case. The details of that, they're not known to me, but we'll be more than happy to follow that up. And I think that's the fair and reasonable thing for us to do.
So, Premier, when you've got somebody from metro area and they're in regions for legitimate work reasons, what expectations of behaviour would be placed on that person?
Well, the rules are really important, and you should be wearing a mask. You should be there doing what you lawfully need to do, and you should be mindful, not just as a function of the rules, but just as a function of common sense. If you're from an area where there is much more virus and you're going into an area lawfully where there's much less, then you have to, I think, err on the side of caution and just to be really, really vigilant. So the mask wearing it and wearing it properly, hand hygiene, all of those things, I think they really come into their own. And I'm really confident that people who, to use your example, they'll value the fact that they can lawfully travel to regional Victoria for whatever the reason may be. And I don't think it's too much to ask that they really be vigilant around that. And all the people that they're dealing with in regional Victoria will value that, I'm pretty confident. And they won't have contributed to the spread of the virus, and it's a wholly good thing.
And could they be fined, though, potentially for not behaving in a certain fashion?
Oh, well, fines are issued based on the individual circumstances of whatever Victoria Police encounter. There are many warnings are given as well where that's deemed appropriate, but fines are issued too. So that's on its own merits, if you like. There are rules, of course, but circumstances can be quite complex.
Premier, can
Last
I ask you,
questions, please.
one for you and Alan, what would be the threshold for removing mask wearing and face covering wearing, and is regional Victoria at all close to that at
to be honest. I've been really clear about this. I'm a holdout on this. Like, we'll wait and see what comes back with the detailed advice, but it's certainly not advice from us not to be there for the foreseeable future. I think it's low cost and it's particularly high reward. And I know it's not pleasant, and I know as the weather gets warmer it'll become more challenging, but for the benefit you get, and there's a lot of international evidence about this as they've moved through similar circumstances to us, you do get a really significant benefit. That's the advice I have. If that were to change, then we will update you.
What is the foreseeable future, though, and what are you actually looking for in this?
Well, to be honest, Simon, I can't answer when people won't have to wear masks anymore. What I'm saying to people as frankly as I can, it won't be any time soon. Masks are going to be part of the foreseeable future. When we can give you a more definitive timeline, we will. That's my view. I think that it's not a massive imposition on people, but it can potentially provide a very real protection against the spread of this virus.
Have you thought about paring some of the rules back? For instance, if you and one other person in your household's going for a walk and you're not going to be near anyone else, have you thought about changing?
I've got no announcements to make about changes in any of those steps.
Premier, just on the model.
That's good. We'll go to Alex and then we'll...
On return travellers, can we just clarify? There's no return travellers from overseas currently coming into Melbourne. Is that still in place?
No, there'll be a very small handful that may have transitioned through another city, and on the basis of compassionate grounds, they may be here doing some further quarantine, even though the plane didn't land here. And I think you'd always want to have a situation where, for instance, if there was a relative who was dying or those sorts of compassionate grounds. There's I think a small number of those people. It's not very many at all.
So previously you've said that we're running contracts, paying hotels and keeping certain staff on for when the hotel quarantine program begins again. Do you know how much we're spending on that program, which is effectively, you said, very small numbers in it, and is effectively...
That's return travellers. There'll be some other people who, for various reasons, whether they be people that have got multiple and complex needs, people who live in large families and don't want to infect the whole family, I'm happy to try and come back to you with whatever I can provide.
Would you be happy to release the figures of how many people are actually going through it, how many hotels we have and how much it's costing?
I'm more than happy to look into that for you.
Premier, can I just ask, what was the process for choosing the modelling team? I know actual figures are better than models.
They are, always.
Of course, I think we all agree. But the modelling team, that the critics say there were no infectious disease modellers, they're on the record going for an elimination strategy.
Well, the good thing is that I have Professor Cheng here with me who can answer all those matters. But before I ask him to do that, let me just confirm for you, any suggestion that I or a member of the government hand-picked this is just utter nonsense. Utter nonsense. Not productive, not helpful, not based in fact. Seriously, like the people who've been chosen to do this work are very good at what they do. They are absolutely focused, as am I, on getting these numbers to the lowest level possible. Of course, I'm not sure whether you were here when I made the point, but I'll make it again. We have a great scientific and medical community in this city and state. I think the country's best. If you put 100 of them in a room, you'll finish up with many different opinions on many different issues, and that's why there's such an amazing scientific and medical community. I'm not so much for the debating of models. I think at some point, this is not a doctoral thesis. Even if it's your fourth doctoral thesis. It's not. This is not what this is about. You've got to call it, you've got to put the plan in place, and get on and get the job done. As for those who are involved, their special skills and the process to select them, I shall ask the Professor to add to that.
So, I mean, I think there's a lot of different modelling groups around Australia and Victoria, and there's also modellers within DHHS, and really the model is selected on, can it answer the question that we wanted to ask? And the question that we were really wanting to ask is how many people can move around the community before we risk a loss of control, or that we have, continued decline in the number of cases. So the modelling that that we have been used to looking at, the R effective, the effective reproductive number, really tells us about the glide path of cases, but doesn't really answer those questions about what is the role of chance and what is the chance that we will lose control. That's a slightly different model approach, and so there's the difference between sort of deterministic and the stochastic models that we used for this.
I think the main concern is just for most people I've spoken to is getting to the 5 average and the 0 average. And I think
Yeah.
even the modelers have said that's extreme. You know, I think
Yeah,
most
so-
people I've spoken to have said,
Yeah.
crikey, you know, is that even possible? You know,
Yeah,
if you have
so-
a plane land or a household gets sick, you're going to have 5 cases.
Absolutely. So, I mean, it's 5 cases a day, so it's not just 5 cases in total. But, I mean, it does, you know, there is going to be a lot of judgment. So it isn't going to be exactly 5 that we're aiming for. If it was 6 and the last outbreak was, I think someone mentioned, like, it was a closed community outbreak and was in aged care, we were pretty sure we had, you know, a ring around it to make sure that there weren't going to be any ongoing cases, then, yeah, we'd be happy with that. Similarly, if the numbers come down quicker than we hope, then you know, we're always, you know, happy to look at that again. So I guess I think I went through this on Tuesday, but I guess some of that judgment is not only numbers, but also what is the chance that any active cases will have ongoing transmission from them, is one sort of major consideration. And then the other one is what is the chance that we're missing something? And that takes into account things like testing rates, the number of unknown cases, who those last cases are, you know, what demographic they're in, and those sorts of things. So there is quite a lot of judgment being exercised right at the
So
right at the end.
flexibility on the 0 targets and the 5 average.
So the target at this stage is 5, an average of 5 cases a day, and 5 less than 5 unknown source cases over the last 14 days. So the 0 was for the regional, and we're.
The last 2 steps are 0.
Oh, sorry, for the last step. So let's get to the next step first, and then we'll
look at
rerun
that
all those
again,
two again, and see what it is that we need to do. But you know, 28 days that's a pretty standard. In 28 days, two incubation periods without cases is a pretty standard definition for that.
Premier, the opposition leader this morning moved a motion or gave notice that he would move a motion of no confidence in October. What do you make of that?
Oh, look, cheap politics is no vaccine against this virus. And that's all I'll say about him and that.
In terms of the Mornington Peninsula, is there any hope that they can be moved along a little bit faster than the rest of Metropolitan Melbourne?
No, we're not doing suburb specific or postcode specific or local government specific at this time. I want to be very clear. We have Chris Brain, the local member down there, has been a constant advocate in relation to making sure that that checkpoint is as active as possible, and I think that Victoria Police went directly to this yesterday. Obviously, with school holidays coming up and better weather, that is a beautiful part of our state, one that I've spent much time in over many years, and I can understand why people would want to go down there at the school holidays for a day trip, or the notion of sneaking down there to stay at a second residence or something like that. That's not that at this time. That's just not on, and that's why the checkpoint's really important. And I think Victoria Police went to that yesterday.
The arrivals cap on international travellers is going to go up to, I think, 6,000. Is there any sign or any prospect that Victoria's hotel quarantine operation might scale back up again?
No. I think it's important that we wait and see the outcomes of the process that's ongoing now. It's also important that it's not a matter of confidence or anything like that. It's simply we've got a really big task to be dealing with now, and we've just got to get these numbers down. That's how we keep them down. We've then got to be hyper vigilant once we start to open up again, that we've got the best possible response in every single way. There'll be a time for the resumption of those flights, but I know it's frustrating, but I can't provide a date now. But when we believe that's appropriate, both to the tasks that we have to perform and the place we're at in terms of how much virus there is, then we'll have announcements to make about that.
What are you doing for regional Victorians who work in high-risk industries in Melbourne, permitted workers, about stopping them coming to Melbourne to work in Treasury and then on the weekend going to the pub?
Sure. There are COVID-safe plans in every single workplace in regional Victoria, and there are COVID-safe plans in all those that are open and with a particular focus on high-risk workplaces in Metropolitan Melbourne.
He doesn't talk about workers, say from Ballarat, who work in an abattoir in Melbourne.
Yeah, and I'm saying that whether they worked in Ballarat or worked in Melbourne, if they're in a high-risk industry, there is a rigorous COVID-safe plan for that industry. I think Jill was here just only a few days ago taking us through some of the enforcement activity, very significant number of inspections, and you can see that trend will continue, not just for the next few months, but right into 2021. No vaccine will mean, of course, until we get a vaccine, then all those settings will remain high risk. For instance, to your point, we even though virus was lower in regional Victoria, we put restrictions on abattoirs and other meat processing facilities in regional Victoria because we didn't want all the work going from Melbourne, because they are inherently a high risk setting. So I'm confident that we've got those risks as managed, as mitigated as we possibly can. And I think in general terms around in terms of outbreaks, we've seen, whether it be in supermarket distribution centres, cool stores, meatworks, we've seen a real step change in terms of the amount of virus that's getting in there, and I want to congratulate everybody involved in that.
The Prime Minister has made comments this morning that he is grateful that regional Victoria is opening up, but he thinks that we should be opening up earlier. Are you taking that on board at all?
Well, I've got a good relationship with the Prime Minister. He understands fully the details of the roadmap and why we've made the decisions we've made. No doubt he's pleased, as I am, to think that in the space of less than 6 weeks we've gone from 725 cases a day to 28 cases today. That is a mighty effort, and I'm very proud of every single Victorian who's contributed to that.
And is there an update on the contract tracing team? No more bolts from the blue?
Oh, from Sydney?
Yeah.
No, I haven't received the report, but it's still my understanding, and as soon as I can provide you with further details I will, but it's my understanding that there were no fantastic revelations on either side. People, and that makes sense, they've been talking often for months, but there'll be some fine issues, I think, probably at the margins. That's at least the briefing I have at the moment. Professor Finkel will provide his report, and we'll look at that in detail. But we had officials that went as well, because it was a exercise in sharing, and I think that there will be a few things we've learnt. There'll be some things that New South Wales have learned as well, particularly, can I say, probably higher risk workplaces, given that we've had more of that challenge. There'll be some things both ways, but there was no 12 hours found.
Just on the ADF issue again.
Yep.
You've obviously said that you will explain your thinking and understanding at the time in the inquiry, but given that you've now had multiple members of the government and high-ranking officials in the department admit that they were aware of the offer of ADF, do you now concede that Victoria was offered help from the ADF, with the ADF in hotel quarantine, that you actually may not be aware of it at the time?
Well, I'm not here to comment on those matters. I answered this matter yesterday, and I have nothing to add to my answer.
Helen, just double check. Who did you meet, or who did officials meet within the Casey region? Which community leaders? Was that?
So there's been a range of community leaders, councils, Monash Health, their outreach teams are there. So there's been quite a number, as I understand.
How worried are you about this holding us back? A new cluster emerging out there that's not linked to, well, it's not in an aged care home or health workers.
Look, I think this is we're getting into the tail of the infection, and strategy is to jump on the tail, as it were. These are the sort of situations we really need to be on top of to make sure that we do get numbers down. And I think I might have said before that, you know, the easiest and the hardest thing about this infection is this super spreading phenomenon. So if you don't have any super spreaders, you know, it can die out very quickly, but it just takes one, and then it can be off and away. So that's why we really need to get on top of this and really encourage, you know, Victorians in KC to come out and get tested, even if they have mild symptoms, just to make sure that there's no transmission chains out there.
So that's what we're seeing. We're seeing a super spreader in the KC area and a bit of apathy from people.
Yeah. So actually, I probably should be clear that it's a super spreading event. It's just where people happen to find themselves. I think you know, Colac was probably another good example of that, and that's, you know, the regions are in a lot of ways a good dry run for you know, what we hope to find in Melbourne in a couple of weeks' time.
Is it though there were clear links to workplaces, and I think, you know, everyone knows pretty much where those cases came from. We haven't managed to establish that here though.
But, so yes, and that's why we need to keep going to find out, you know, where are all these transmission chains, where might it have run to, so that we can get on top of them.
So, we're down to a very small number of cases now. We're all, obviously, Victorians are desperately keen and keeping a close eye on these cases. I understand if you personally don't know where these cases are spreading, but if that's the case, could you just tell us, or is it that the system doesn't know, and if the system doesn't know this far into the cluster, why? And surely that's a problem.
Oh no, absolutely. So we do know we know all the people, all the cases that have been reported. We know where they live. We know who they are. We've spoken to them all. what we, there are things that we don't know, and we've obviously contacted all their close contacts to make sure that they're in quarantine and they're being monitored. But we always just need to be careful that, is there someone that has been missed? Is there people out there in the community? There are still some unknown cases. We need to try and put a ring around those to make sure that those transmission chains are shut down as well. So we obviously know a lot about the cases that we do know about. It's the ones that we don't know about is the ones that we worry about.
Given that the numbers are so low.
Casey?
So it's spreading in a number of households in Casey, and we're also, obviously worried about all the people that they've come into contact with outside of that.
So are they linked households?
So we're not entirely sure how they are linked, but I don't think it's rocket science to say that a number of households in Casey are probably going to be linked in some way. They're, relatively close to each other, and we're still working to establish those links.
Are you dealing with apathy, like people just not thinking the virus is serious in these communities?
Yeah, no, I don't think so. I think it's one of the things we worry about is that as numbers fall, testing rates tend to fall away because people are worried a bit less about it. And certainly that was sort of the experience in the regions, and we sort of went out very strongly to make sure that, where there were still areas that we were worried about, Colac, Geelong, Apollo Bay and so on, we made sure that there was sort of a major testing push. We're still getting 14,000 tests a day. It obviously dips a bit on weekends, but there's still quite a lot of testing going on, and that gives us some confidence that we're not missing too much out there. We're still picking up unknown cases. It's still important to get tested, and we need to track down all of those, but there is still quite a lot of testing going on, and we're thankful for Victorians for helping us with that.
Are you considering asymptomatic testing in Casey to try and nip this outbreak in the bud before it gets any bigger?
Yeah, the biggest bang for your buck is to get symptomatic people to come forwards. There is a role for asymptomatic testing, and that's mainly in close contacts of people. So there's obviously a lot of people in Casey. We can't test every single person, but anyone, even with mild symptoms, should get tested, and we encourage all of those to come forward.
Given that the numbers are so low, previously it said that we couldn't release where the mystery cases were just because there was too many. Now that we're getting down into lower numbers, is it possible to release on the daily LGA list where the mystery cases are?
Yeah, I'll have to see what we can get to. Clearly there is a balance between protecting the privacy of the cases, and particularly when you get down to small numbers, sometimes people can become identifiable, but also the public health risk and the need to do it. So if at the moment, obviously, a lot of things are closed, but if there was a public place where there were cases and a potential exposure, then we would report that.
Will we move to similar to what they do in Sydney when the numbers are low?
Yeah, we've been doing that, and certainly in the regions, you'll notice that there were public places that were times and places that people were asked to come forward for testing if they had been there.
Alan, can I just clarify one thing? You talked a few minutes ago about 28 days with 0 cases. That's 28 days, 0 unknown cases.
Yeah, that's sort of getting right down the track. Well, the next step is for the third step in Metropolitan Melbourne is an average of 5 cases a day with 5 unknown cases over the previous 14 days. So, we will obviously look at targets and the situation after that, but the next, our attention at the moment is
reclassified cases, isn't it? Because
So total of 5 cases.
Why does it take Brett Sutton? I heard him on 3AW radio the other day at 9:30, I think it was in the morning, and he knew the reclassified case number. Is there any reason we can't get that earlier in the day?
I'm not sure which. So we update them.
Yesterday, I think the case number was 42, and then a few hours later, we found out it was 32.
So it wouldn't be that. Okay.
No, the reclassifications relate to the total. The number I report here every day of new cases are actual new cases. So going back, not necessarily for the previous day, can be over a few days. There can be multiples, and they're taken out. So the aggregate number, that nearly 20,000 number, that gets adjusted, and that's why on a day when there's any reclassifications, the two things won't actually add up. There's a slight difference. That's why we talk about the reclassifications. But when I say 42 more cases or 28 new cases, there are 28 new people that we've got positive results for.
Is it really good enough that we're having those duplications every single day though, and doesn't it suggest that you don't have a handle on, you know, what's an actual case?
No, I don't think it suggests that at all. I think it suggests that you've got many different inputs, you've got a large team, large number of labs, many complex circumstances. Yeah, for instance, I'll give you one example, Rachel. We thought we might have had a mystery case in Shepparton, right at the time when we were, a case, which then could have been a mystery case, in the Golden Valley area. Just the other day, when we were right on the cusp of taking the third step in regional Victoria, turned out that that's the person's residential address. They're not in the state, they're in New South Wales. They haven't been there for a long time. So there are lots of inputs. We get advice, for instance, from other interstate labs, if that's one example of that. I think it's indicative of a good degree of caution, always cleaning the data, always wanting to be rigorous. And I think that's much better than not doing that, only to have numbers that you can't actually rely upon. Where there's reclassification needed, reclassification will be done.
Of course, but why is it taking more than 24 hours to do that? It just doesn't make sense.
Well, I don't see it that way. I think people do it as fast as they can, and we update you as fast as we can. And look, if I did 3 of these hour-and-a-half sessions a day, I'd probably update you more often. I do a daily update, and there's a show release, and if we can in any way get you more information quicker, we will.
I meant with the duplicated cases, why is it taking more than 24 hours to realise that they've been duplicated? And that is happening every single day. There were 10 yesterday, you know, there are 2 or 3 most other days.
I don't think it's been every day. I think there are some days when there's not been a need to do that. But again, I think you'll see that. I think you will see that reduce dramatically as the numbers reduce.
Just on the expectant
Last one, please.
mothers, obviously that
You're not going to keep me, make me late for Parliament, are you? They'll be
like
very upset. I mightn't be that upset, but they will be.
Plenty of women are expressing that they were hoping that they wouldn't have any kind. Obviously, the restrictions have been loosened, but many
Yes.
are apprehensive that they're still, once their partner leaves the hospital after they come for the initial visit,
Yep.
that they won't be able to return. Will you look at lifting that restriction specifically?
I think at the time will come when we can review those matters, but we will need to be
At
in a.
what date will that end at this point?
I can't give you a date, but I'm happy to have a look at it for you and ask the relevant teams to come back if there's any change, or if they've kind of got line of sight of when that might be. We know and understand that that's a challenging thing, but at the same time, you know, having been through that process myself as a dad 3 times, I think in general terms, not in any way downplaying how challenging that the virus is for families in those circumstances. I think the safety of bub and mum and other patients, that's got to be the top consideration, and that's exactly what maternity units and hospitals are doing, whether it be in maternity, NICU, in any setting. This is wildly infectious, and it's not something we want anybody to be getting, because it can be deadly, and for those for whom it's not tragic, it can be a really long-lasting chronic illness, not just a common cold. If there's no other issues, I'll just say these numbers are going in the right direction. The trend is with us, and that's all down to the hard work of every single Victorian. I'm proud and grateful. This strategy is working, and we will continue to report to you, and if we all stay the course, we will be open, and we will be able to stay open. Thank you very much. I'll see you tomorrow.